Hello, beautiful people. Welcome to On the Bright Line podcast, Tales from Recovering Food Addicts from the perspective of a physician, a therapist, and an off-the-wall storyteller. We are not affiliated or endorsed by Brightline Eating, and all content presented in this podcast represents our personal opinions and does not represent medical, nutritional, or psychological professional advice. Well, hello and welcome to another episode of On the Brightline podcast. We are in a new location. We're actually in my house today. No more Bonnie's house for right now. So you guys get a little glimpse into my life. Welcome to my house and my dining room table. So on today's episode, we are going to talk about how to choose a therapist, and we are going to rely extremely heavily on Robin's expertise as a therapist on what is the best way to choose a therapist. And Bonnie and I are going to weigh in a little bit on our own experiences with choosing a therapist in the past. So I'm going to go to Bonnie first. Can you talk about because we have all been in therapy. This is not probably news to anyone who's listened to our podcast.
Right. Right. Kind of knows how we are.
Right. That's right.
You're like, yeah, we need therapy.
We do. We all need therapy. We've all been in therapy. But so we're gonna, obviously glean from a little bit of our own experiences. So Bonnie, why don't you tell us about the times you've looked for a therapist, how you've done that, how you've gone about it, and Robin, you can weigh in as you want.
The first time I looked for a therapist, I was in my early 30s. And I think that was back when I was still fully not living a life for myself. I had just worked really hard to become who my parents wanted me to become. And I encountered, and I had always been the golden child of the family that, look, Bonnie, look at what Bonnie's doing, right? It's just like, so I had this mantle to uphold that I was the fixer of everything. And I really kind of thought I had magical powers that everything would work out okay if I worked hard enough.
Oh yeah.
And I had, I had gone into private practice and I had my first patient who was dying and I could not figure out what was wrong with her. And I was on the bioethics committee and I was the person who helped to convince other doctors when they were doing too much, that when patients wanted to die and they weren't letting them, I would be like, we can't do that. And I had a nurse come tell me, your patient wants to die and you've been doing every test and everything and you're not listening to her. And I was just crushed. And I got really lucky because I was connected to the medical community and I got a referral for a therapist who, if you hear this whole story, you're like, duh, like you can't control stuff, right? So this is a pretty easy case, I'm guessing, for this gentleman, but he helped me immensely. And, within 30 minutes of hearing my entire story was like, well, here's the deal. And he set me straight on that topic. So I was able to do a lot of work on that, which was great, but I moved away from there. And, I have sought therapy around like family issues and that type of stuff, but for my food issue, and I had a great therapist for that, by the way, again, referred from somebody I knew. So I got lucky and it was someone that took cash only. That's amazing. So if I had had to use my insurance, I never would have found that person. That's a barrier that Robin, I'm sure we'll talk about. When it came to finally deciding I wanted to deal with my food issues, I just sought out, I'd had kind of two good experiences. So I thought, I can find somebody. And I found somebody in my town and was a very nice person and had kind of their way of doing things, but just wasn't really hearing me. And to be honest, I don't think a lot of therapists probably even know about food addiction.
Yeah.
But I remember just sitting in her office and saying, I keep getting up and getting a snack. I can't stop myself. I don't want to be doing that. I don't understand what's going on. I have tried everything in my power to figure this out. I don't know. And her reply was, well, why do you think that is?
Right.
And I was just like,
right.
Thanks for all the help.
Oh my gosh. So, really like it just was very disheartening. And it kind of shut me down from even trying to find another therapist because I'm like, that was so painful to you have to go through the whole disgorgement of your
being vulnerable.
And your history to try to get someone to understand where you're coming from. And then to have that happen. And I went a few more times and, she was kind of doing her thing and it wasn't really touching on the real problem. Right. I kind of told her like, I've been to therapy before, like I've kind of dealt with some childhood trauma. I've dealt with some stuff. This is different. I don't understand this.
Right.
And it was really disheartening. And I kind of gave up. And I got lucky that I found Bright Line Eating. and, was able to get back in
Mhm.
and work on this myself through the program. But
Mhm.
that was very, very hard.
It is because you go and you're sharing, you're being present and vulnerable with someone, and when they're not able to meet you there, or be willing to do some of that deeper work, which is generally the complaint that I hear from people, right? They'll come in and go, yeah, like my therapist, nodded and smiled and took my money and set me up for next week. But never really worked on constructive change or some of that deeper work. Right. And now I will say it's, we've got to be in a place where we're ready to do that.
And I also know, like, you have to give it a few sessions. So, and I did, I think
Yes.
I went to 4 or 5 sessions.
Yes.
And then just felt like we were like, then I felt like I was almost like I need to perform for her because she can't figure this out. And I have to help her feel better by
People
helping
pleasing.
her figure out what it is.
People
That's when
pleasing.
I stopped, right?
Yeah.
But I think, that is important for people to know. I would say in any therapy experience I've had, the
Yes.
first couple sessions do not feel good
Yep.
because you are talking about some uncomfortable stuff. You are being
Yeah.
vulnerable with a new person.
Yeah.
And you kind of have to ride that out to get,
Mhm.
to get to the
Right.
solving.
Because those sometimes those first couple of sessions are assessment sessions where they're really just gathering data. That's not necessarily where you're, diving in and doing the work and feeling better. It's because, we've got to gather that data to formulate, oh, okay, like, I kind of see that where this is coming from. Like we have to formulate goals because we have to do documentation and paperwork and all of that. And like you were naming, if you're using insurance, there also has to be a diagnosis,
Right. Right.
right? That you have to understand that you will, if you go into therapy and you are going to use your insurance, you have to have a diagnosis. And if you do not meet the criteria for a diagnosis, your insurance will not cover it. And the therapist will say, sorry, I can't bill for that. And insurance does not cover counseling for weight loss. There is no
Well,
diagnosis
because
code.
there's not a diagnosis code,
Yep.
which
there-
we've talked about.
Right.
We've talked about this
Right.
before here. Yeah.
Right. And so that I think is another struggle,
Yeah.
you know.
Do you want me to talk about my experience? Okay.
Yeah, yeah.
I was like, in my next.
No.
Tag.
No, we don't want me to talk about it. So I have been in and out of therapy since I was, early 20s, childhood trauma. Oh, you okay, Robin?
Yeah, there we go.
Robin's talking around the microphone today. So yeah, childhood trauma brought me to therapy just because I was really struggling just with, these grieving feelings of like, the world's a horrible place. Why do horrible things happen to
yeah.
horrible, to
Yeah.
people, like all that kind of stuff. And so, I think that early on, I think the first therapist I went to was on the referral of a friend, and that's how I found them. And I've always used insurance when I've done,
Yeah.
work with a therapist. I think the most interesting story I have to tell about therapy is that during COVID, so for those that don't know, I had my youngest son in January of 2020. And so that was literally like right before COVID. Yeah, right
Yeah.
before COVID hit. My niece, actually one of my she's 17 years older than my youngest son. So, she was 17 at the time, came and visited in February, like a month after he was born. And we were worried she wasn't gonna be able to leave because that's when like everything like was kind of jumping
Yeah.
off. So I'm at home, basically on
Right.
maternity leave, for 2 months with a brand new baby. And then the world shuts down. And the day I was supposed to return from maternity leave is the day that they basically said, come to the office, grab all your stuff. You're going to work from home for a couple of weeks.
Right.
That's what they said, for a couple of weeks. And I was like, okay. So I was like, cool, this is awesome. I get to stay at home a couple more weeks with my baby and whatever. And so, I did that. And so then as we all know, like it dragged on and on and on and on and on. Yeah, we're not really gonna go right. So I think at some point, like I don't even remember when, it was probably about a year in. I knew that I was not doing well. I am an extrovert. Yes, I know, so shocking. But I like to be around people. And I remember it was even you weren't up here yet.
Nope.
I'm pointing to Robin,
Yeah.
but Bonnie was here. And I remember because of what her and her husband do for a living, it was really hard because of just the, the instance of like they had been exposed or they could have potentially been exposed or
Yeah.
had COVID, all these
Right.
things. And like, even like I had it, my older son was in, going to school. Well, they were at home for a little while, but then, going to school. And so it was just even hard to even get together with your friends at that point,
Yeah.
because things were just really shit. So I was really having some depression at that point that was, abnormal, over and above my food addiction, which I wasn't even dealing with at that point. So
Right.
I got in with a therapist and I found her through my insurance, and we did virtual sessions. It was my first time ever doing virtual therapy before. And it was great. I mean, I would get on the computer and we would have our session and I'm like, this is amazing. Like I can do it on my lunch break, right? Like it was so cool. And so we worked together for a while, and then she ended up leaving the practice she was at, went out on her own, and that's when it kind of dissolved. But that's another story. But I just think for me, it transformed my life because I was able to then have this relationship where I didn't have to get in my car. I didn't have to go find parking. I didn't have to go up to an office. I didn't have to get dressed, guys.
Right.
I could do therapy in my PJs, like
Made it accessible.
it made it very accessible. And I think that's, I think that's really the cool thing now is that a lot more therapists are doing virtual, like you can do things telephonically. And because I also work for an insurance company, the insurance companies are now paying for it,
And
which
initially they weren't. And before the pandemic, like zero, like absolutely not. That's not real therapy. We're not covering it.
And then like
then they
overnight.
they overnight they had to switch their tune. And then they still said, like, as soon as this is over, like it's back in the office for you. And then after a while, it's like, hey.
Well, it's just like even my work. I work for a health insurance company. For the first year at least, they were saying, we'll be back. We're going to come back. And we're a in-person company, blah, blah, blah. And then after 2 years of being at home, they're like, nope, we're selling off all the real estate. Like no more office. Like literally we went from, I think we had 4 floors in the building here in Tacoma. So I live in Tacoma. We had an office in Seattle. We had an office in Spokane. And I think there was an office in the middle of the state someplace too. We literally have nothing else except for 1 floor in the building in Tacoma now. Wow. Nothing else. And it's like, if you go, there's maybe 5 people there. Like there's just nobody that goes to office anymore. Anyway, this is a whole nother subject. But yeah, I mean, we definitely have a work from home culture, and it is amazing that that health insurance did. I mean, it's really, and let's be honest, it's really CMS. It's really the government that finally got on board with flipping the switch on making telehealth, behavioral telehealth accessible and reimbursable, because for those that use their insurance, which is what makes it accessible, it's now available. So
yeah. And all of the studies on telehealth show that it is just as effective as in person.
Awesome.
And
I wrote my capstone on this for my master's degree.
And I will tell you that the vast majority of the therapists that I know at the beginning of the pandemic swore telehealth was never going to be as good as in person. Right. And my argument is the fact that it makes it accessible for more people, for people that maybe live in small communities where maybe there was only one therapist. And if you didn't like them, you were out of luck, or you're a caregiver, or you're a parent, and
or you're older and you need a ride.
Exactly. And I mean, I work with a lot of senior citizens, and so many of them have said, I've never been able to access therapy before.
But let's talk about, let's go even deeper down that rabbit hole of like people like specialization, like the special, like, because therapists specialize in certain forms of therapy, right? And so that the ability to then access somebody who may not be in your community that specializes in something is just, and again, I wrote my capstone on this for my master's degree. So, and there are studies that show, like you said, that, and there was one very specific, I did it on trauma-focused cognitive behavioral therapy. And so there was a study, and it was an emerging study because it's new, but that showed that and it was on youth and adolescents, that it was just as effective. Just as effective. The effectiveness of the therapy was equal to, if not even better, in some instances, being delivered telephonically. So I'm sorry, we're getting really into the weeds.
Now that we have that established, right? You don't have to live right near a provider. So the question is to you, Robin, like, how do you begin?
How do you find it?
Hey, I think,
Okay.
you know, I've
mean,
got my
some
food program, but
therapies.
that's opening up a lot of stuff that I
Right.
need to
Yeah.
deal with, right? So
Right.
where do you start when you just like don't know where to start?
Right. So step one is deciding, are you going to use your insurance or are you going to private pay? Right. So I recommend to everyone, you can find out what your benefits are. You can call your insurance company, right? And say, if I want counseling, what are my benefits? Do I have a deductible that I have to meet? Will I have a copay? Are there limits on, what you guys will cover? If you're going to use your insurance, again, you do have to meet the criteria for a diagnosis, right? Which, things that insurance will cover are, anxiety, depression, PTSD,
Right.
Adjustment reaction. I mean,
adjustment
that can be
disorder.
Not food
very-
addiction or binge eating
Right.
disorder.
Right.
I just
Right.
want to put that out there. Not food addiction or binge eating disorder. Neither of those things are even diagnosis. Well, are they?
Well,
Binge eating
binge eating
disorder
is.
is.
Okay, binge eating disorder is.
Yes.
But
yeah,
addiction
but
is
but
not.
food addiction is not. Right.
Obesity or food addiction would not
Right.
be able to be used for that.
Right.
But we have a food addiction usually for other reasons. So those are the things that can
For
be used.
sure, for
Right.
sure. There are other diagnoses that can be
Yeah.
used. I'm just
Right.
saying, like,
Right.
you can't walk in and say I'm a food addict, help me.
Right. You can, but you'll have to private pay for that.
That's right.
Right.
And you have to find somebody that will be able to, and willingly
That's
accept
the
the
ne-
fact that
That's the
food
next
addiction is a
piece.
thing. Yeah.
Because so once you decide, I'm going to use my insurance or I'm going to private pay, defining what it is that you want to work on, right? And being willing to formulate some goals, right? What would you want to be different? When you're all done, what would you like to be different about yourself? Because then you can start the process of interviewing therapists. The best places that I recommend to look for therapists are Psychology Today, which is psychologytoday.com, and Therapy Den, therapyden.com. Therapy Den specializes in having a lot of therapists that are LGBTQ plus honoring, that are
Well, and that's searchable. I want to put that
Yes.
out there. Like, so if
Yes.
you identify as, part of the, LGBTQIA
right.
2 plus all the
Yep.
letters.
Yep.
Sorry,
Yep.
I'm mucking that up, I'm sure. But like, if you identify that way, then you can definitely,
Yeah.
you can search for that, and you can filter a therapist that
Yep.
way. But also, what you can filter by like what your disorder is. So like, if you know you
Yes.
have depression, like you can find someone who specializes in depression,
Yeah.
right?
Yeah. And so for both of those sites, I know for Psychology Today, you can put in, what zip code you're in. You can start by, what zip code are you in? And then it will populate a search, and then you can further refine that by, do you want in-person? Do you want telehealth? What insurance do you need them to take? Do you want a male therapist or a female therapist? What specializations do you want them to have? So that's a great way to populate some different options, and read a little blurb that therapist has written about themselves to say, does this person sound like someone that I would like to work with? Right.
I also want to caveat in here, if you're going to use your insurance, and I could just, maybe even you're not going to use your insurance, that
Mhm.
therapists can only practice, because we have people all over the United
Yes.
States and all over the world, really, that
Yes.
listen to our podcast. Thank you to all of our international people too, because none of this applies to you, because we're talking about the U.S.
Probably have
system.
access to health.
Yeah, you probably do.
Yeah.
Good for
But
you.
therapists can only practice in the state in which they are licensed.
Yes.
So let's take, for instance, Robin.
Mhm.
She has a license in more than one state.
Right.
But that is not the case for most therapists. Most therapists only carry the license of the state in which they sit in. So
Yeah.
this is a really cool thing, and we're going to go on another bunny trail right now, because I think
Mhm.
it's really interesting that they are working on legislature. And I
Yep.
know for the
Counseling compact.
yeah, well, now the PSYPACT is already in.
Right.
So for the PhD level of psychotherapy, there is now legislature in almost all the states that
Mhm.
allows them to extend their license if they join this organization,
Yeah.
PSYPACT, to any place where that's
So-
part of PSYPACT.
So this
It's
means
coming.
that, like, does this also mean, like, if I had a therapist in Texas that I like, but I live in Washington, I can see that therapist?
So-
No, it depends on,
Okay.
are they part of the PSYPACT
Yeah.
or the
So if they
counseling
are though,
compact?
then it would allow that. This
Yeah.
would-
Yes.
Oh,
Yes.
okay.
So
But it has to pass in that state.
yeah. So like, for instance, Washington State, it was in I think it was in 2022.
Mhm.
And people are fact checking. Tony Wade is fact checking me
Right,
right
and-
now. I know he is.
Mhm.
I love you, Tony. But I'm just so anyway. So when that legislature passed here in the state, and so there became we call them WACs here in the state. That's that's the
Mhm.
legislative, like
Right.
the WAC,
Mhm.
is how we abbreviate that. So the WAC here in the state then went into effect that if it's a psychology PhD is part of the SciPact organization. So they
Right.
have to apply and be credentialed through them. We are getting way in the weeds right now.
Yeah.
But then they are allowed then to practice in any state where that
That is part
legislation that
of-
is part of
yeah.
SciPact. And
Yeah.
as of right now, there was like 38 states last time I checked. There are it is
That's awesome.
literally sweeping the nation.
Right.
And I guess now there's a council. So
There
what's
is.
the licensure that you
Social workers and LPCs.
so licensed
And I just
practical
saw
counsel,
that, I just saw that Washington jumped on board with that. And they had to have 7 states that were willing to ratify
Yeah.
that, but that's still a couple of years out.
Yeah, for sure. So, but I mean, it's
coming.
It's coming, and
Yeah.
this is only for virtual visits. These are not in-person
Right.
visits. So like that's the thing.
Right.
It's like these are people who are doing, and so it's opening up the world.
Wow,
Right.
that means if you find an amazing therapist and they're in another state, you'd be able to use them.
Not only that, but let's say that there's a therapist in New York that does a
Right.
specialty kind of therapy that you need.
Right.
You can now access that therapist, and their licensure will extend into your state if you're part of this SciPact and more. I mean, like I said,
It's coming.
again, somebody can it's SciPact.com or something like that. You can
Yeah.
look it up, but there's a bunch of states that are a part of it, and it's the domino effect is coming because
is.
the nice
That's
thing
the
about
part that they do.
healthcare and the way
Mhm.
this works is where one thing goes,
Yes.
everybody else follows.
Follow
So
suit.
yeah.
Right.
Again, we're in the weeds. Sorry, guys, but it's where we are.
So I would say, after you decide, are you going to use insurance or not? You do a search to find some options. You define what it is that you want to work on so that when you start calling therapists, you can be able to ask questions. Right. And so some of that is, these are my issues. Do you have experience working with those?
Yeah.
Tell me what your theoretical approach is. Right.
Write these down, people. Write these down.
Right. Cognitive behavioral therapy is a big one. In BLE, IFS is a big one.
Internal family
If you've
systems,
got,
yeah.
if you've got trauma, you might want someone that works with EMDR or has a trauma specification. It's really interesting. A lot of therapists have, lots of letters after their name. Be willing to Google that.
Yeah.
Are they an LPC? Are they a social worker? Are they an LMFT?
LMNOP. Sorry.
Right.
What about, Robin, the people that like cite that they do play therapy or art therapy?
Uh-huh.
What does that mean? Like, can you describe, like, we don't have to do a whole course on it, but like, just when they're looking at those kind of things, what does that mean?
Well, so it kind of depends.
Okay.
Because some of the questions, right, I'm gonna name one of my big therapist pet peeves. I hate when I am looking at therapists' blogs or websites or listings or whatever, and they say, I do trauma, divorce, grief, eating disorders, play therapy, marriage therapy, EMDR, right?
I am the master of all universe.
Because to me, a lot of those things are real specializations. And so if I see someone saying they do all of those things, in my head, I'm like, there is no way they do all of those well. Right. So if you're truly looking for someone that has a trauma background, I would want to know what trainings they've done. I would want to know who do they follow? Who are their favorite trauma people? What are some of their favorite trauma book recommendations? What are the trainings that they've done?
And how many people do they work with that kind of problem?
Right. Is that a large percent of their practice? Is that a small percentage of their practice? Because it's really easy to say, yes, of course I do, trauma or this or that.
Yeah.
Cool. Tell me about your approach to that.
Yeah.
Tell me what trainings do you have? Like, do you have a certification in that? Because some of those things like IFS, you can be IFS certified, right? Which means you've gone through very specific IFS training and you have a true certification. You can also simply be IFS informed, which means, hey, I've done a lot of IFS trainings. I just don't have the certification. And with IFS, it's really freaking expensive and time consuming to get IFS certified.
Yeah.
There's don't get me started, a lot of gatekeeping. So again, that question of, hey, therapist, tell me why I should come to you.
Yeah.
Like interview them.
Yes, it's kind of like a job interview. I look at finding a therapist kind of like dating, right? Tell me why I want to share with you. Tell me why I want to.
Is that how you start dates?
I kind of do.
I'm kind of scared right now.
No one expects the Spanish Inquisition. Right.
I love it.
So, and it's being willing to say, are you someone that I want to be vulnerable with?
For sure.
Yeah.
Are you someone that's going to be able to do this deeper work? Right. And you guys were naming, is this also someone that believes in food addiction? Because I will tell you, the vast majority of therapists out there right now will tell you there is no such thing as food addiction.
Yeah.
Right. So,
well, in so much as you got attacked on a message board the other day for mentioning it.
I got jumped on.
Yeah.
Right. And so that's probably going to be a really important question, because if you're a BLEer and you're going to a therapist who then starts reading you the Riot Act and telling you there's no such thing as food addiction, that could be traumatizing.
It could be.
And
will be.
Right. And so being willing to name that up front, you know, to say, I do a program.
And I think a lot of I mean, just, from my experience, that therapists have these intake forms that you can fill out. And I think these are things that you could put on an intake form, right?
Nope. I would not even.
Nope.
I would not do the intake form. You do not want to schedule with a therapist if you're wanting to be able to process some of your BLE stuff. That is an interview question of
before you
even fill out any of. Do not waste your time, because I will just tell you, it's emotional to fill out that.
Oh no, for sure. Yeah, for sure.
Right.
For
and so being willing to say, hey, this is a program I follow. What are your views on, food addiction? And if they flat out say there's no such thing, that's horrible, XYZ, then you've already got your answer that's probably not someone that you want.
And do you think like if somebody, I'm just thinking like, oh, my little wheels are spinning. First of all, I'm thinking like as a BLE community, we should start promoting therapists that we encounter to each other that are comfortable with.
Yeah. And I guess that's
number one.
Right.
Unfortunately, that gatekeeps people outside of the community, because there's not, I mean, if we do it within the Facebook community, like there's not a way.
You can share those names, and then you can.
No, for sure. Absolutely. Yeah. That might be a good thread. It might be a good thread to start in the Facebook community, is that, do you have a good therapist, or do you have recommendations for good therapists?
Like somebody that believes in food addiction and also knows IFS would be amazing.
Yeah.
Right. I really liked the program.
Right.
And the other thing I was thinking is, should if you're just, trying to wade into these waters, you've never even thought about getting a therapist for, and you're worried, oh my God, I don't know, I got to deal with who knows about food addiction.
Right.
Should they start with someone who puts addiction as something that they specialize in?
It can be, but I think there are still people that will say there's no such thing as food addiction, right? Because that's different, because a lot of course, I don't know any therapist that wouldn't say, well, of course there's, alcohol addiction and gambling addiction and sex addiction, but there are still a lot of therapists.
But if they specialize in addiction, that's what you're asking.
Yeah, I'm just saying, somebody says that might be their main special. I'm just thinking like that might be a good place to start. If you're going to have to interview 6 people to get one that is going to take you seriously.
Right.
Maybe starting with someone that at least already understands addiction.
Right. That says
in other ways, right?
Sure.
Let's face it, like the escalating thoughts, perseverating thoughts, escalating behavior.
Sure. Yeah.
All the things.
Well,
it's the same for every.
It is the same for every addiction. And that's the thing is, I guess you need somebody to admit that, like, you could potentially have the same, the same addiction just to food and not to drugs or alcohol. So.
Right. I think the other piece is being willing to interview, some different therapists, right? To get a vibe, like vibe check.
Yeah.
Right.
How do you do that, Robin?
No. There are a lot of therapists that will offer a kind of a free 15-minute consultation, either by phone or via Zoom, and take them up on it. but have your list of questions. This is not a therapy session. Do not go and dump. Be willing to hit your interview questions of
Yeah,
saying,
don't talk about what
Right.
you need help with
right,
at all. Yeah.
short and sweet, be concise, because you want to really find out, you know, do you guys vibe? Do they understand your issues? Do they feel like they're a good fit for you? Because I will tell you, I've had some clients that I've, had some consultations with, and I've just been able to go, hey, I don't think it's a fit for me. I don't think I'm the right therapist for you.
Mhm.
Right. And if I have resources, I'll direct them to that. Otherwise, I'll redirect them back to Psychology Today. So it's
Yeah.
got to be a good fit on both sides. So don't be shocked, if a therapist says, gosh, I don't specialize in the things that you want to work on.
Mhm.
Right.
Which is actually a sign of a good therapist.
Well, sure, for sure. I mean, I think that's the reality. It's
Yep.
like you want to have you want them to have the good boundaries, and you want to have the good boundaries to say, we're a good fit. This is going to make
Yeah.
sense for us to work together, right? And that if it's not a good fit, to say
Mhm.
this doesn't make sense. I mean, we've talked about ending relationships in like the BLE sense before,
Right.
but it's kind of the same thing. It's like you've got to be able
It
to be
is.
willing to say like this is not serving me, and if the purpose is to heal and
Yeah.
to work through trauma and
I mean,
to
this is your life. This is the most like if you
Yep.
can get a hold of the issues that interrupt, healthy behavior for you,
Yeah.
it's life changing. It's
Yeah.
life critical. So
Yeah.
take it as seriously as like, if you went into you went into a medical clinic because
A
you had
doctor,
cancer.
sure.
Yeah.
It's because you had cancer, and they're like, "Well, I don't treat cancer, but come
Sure.
on in, and
Sure.
I'll Google some chemo." And
We'll kick it
like,
around a
you
little.
do that, right? And I think
Right?
your mental health is as important as
Mhm.
as not having cancer or your
Absolutely.
heart health, or it's
Absolutely.
so vitally
Right.
important.
Yeah.
So take it seriously and take your time to
Because
find the right person.
Because Bonnie, just like you were saying, when it's not a good fit and you're getting that message from the therapist that they're not vibing with you or they're not hearing you, that gives you the message, got it, can't be vulnerable with this
Yeah.
person
Right.
because they're not safe,
Yeah.
Yeah.
which is what will keep you from being able to do any of that deeper
Yeah.
work. Because
Yeah.
why the heck am I going to bare my soul to
Yeah.
someone that doesn't feel safe?
Yeah.
Right. And so again, going back to like my dating analogy, be willing to give it, a couple of sessions. If you go into that assessment session and go, absolutely not, hard no,
Right.
right? The way you break up with a therapist,
Yeah.
you can flat out tell them no, like, hey, I just don't feel like it's a good fit.
Yes.
If you struggle with that, if you struggle with being direct, at the end of the session, you can say, you know what? I kind of need to think about it. I will call you when I'm ready to reschedule.
Yeah.
I have your number.
Right. Exactly.
And can I tell you that breaking up with a therapist makes me so uncomfortable? I mean,
Right.
I did the whole, well, I don't think I can make it this week.
Yep.
And I'll get back with, I just like,
Yep.
I didn't have the,
She ghosted her therapist.
I didn't have the guts to just say, I don't think this is
Yep.
working, because I felt so bad. Like
Yeah.
I really,
And
Yeah.
that is the number one
Lordy
way.
be.
The number one way that people break up with a
Yeah.
They
therapist
ghost them.
is canceling an appointment and not rescheduling.
Absolutely. That's what I did.
Right.
Guilty.
And there's
Well,
nothing
so
wrong
let's
with
talk
that.
about. I was just going to say, let's say that out loud. There is nothing wrong with that.
Nothing wrong with
100%. If
that.
you do not want to have the confrontation, that is the way to break up with your therapist. And more power to you. And 100%. You are your own person. You are an adult. You can make those decisions
Yes.
for yourself,
And
and you
let's
don't
face it.
owe it to anybody.
No.
And let's face it, if you're at a place where you're needing therapy and that's why you're going because you're struggling with a lot of big emotions,
Right.
you might not be in a place where you've got
Absolutely.
in,
Yep.
in this moment I'm in right now, I could totally
Yep.
go, oh, this isn't a fit.
Yeah.
But
Sure.
at that time,
Yeah.
I was not in a good place.
Yeah.
Yep.
I was not in a good place.
Yep.
And so, I mean, already like I'm having the whole devastation that no one can help me with my problem.
Right.
This
Oh,
person
yeah.
can help me with the problem.
Yeah.
Yeah.
And now I got to deal with the whole breaking up. I mean, the whole thing, right? It
Yep.
was just too much. It was
Yeah.
Yep.
overwhelming.
It's
So,
heavy.
yeah.
Like when I wrap up my first session with a client, usually I'll say to them, look, it has to be a good fit. How are you feeling about this?
Yeah.
And I'll usually say, do you want to go ahead and reschedule now, or do you want to think about it? I
Give 'em
build
that out.
in and
Yeah,
out.
Yeah.
That's great.
Right. And so they always have the option to do that.
Again, because Robin's a good therapist.
Well, I try. Right. Because it does have to be a good fit. If
Yeah.
you're not feeling safe,
Yeah.
you're not going to get any
It's a
work
lot of
done.
work that needs to be done. And if it's not gonna get you anywhere. It's just,
Yeah.
it's time, it's
Right.
money, it's everything on
But-
both parts.
But you've also got to be ready. Like I've had a lot of clients come in and say, "Oh, I've had so many bad therapists, they've never helped me."
Yeah.
And usually my immediate response is, "Were you ready to do the work?" Because you know what?
Yeah.
It doesn't matter how good
Yeah.
a
I went to two
therapist I
therapists
am.
and they didn't fix me. I'm
Sure.
sorry.
Right. Yeah. We'll talk about expectations in a minute. Right. But if
Yeah.
you're not ready to do the work,
Yeah.
then you could go to the best therapist on the planet and it's not gonna happen.
I've also had the patients that are like, oh yeah, I go to therapy every week. I've been going to the same guy for
Yep.
15 years. You're like, wow.
But for some people, that's what they need, right?
Yeah.
That accountability
Okay.
feels great.
Yeah, but I feel
Unless it's
I'm gonna talk about anonymously about someone that I know and not anybody in this
Uh-huh.
room. I'm not going in
Yeah,
this
no.
room. But it's like somebody who literally have been going to the same therapist and like having the same issues and never, I mean, like, and I'm like, okay, why is your therapist not challenging you on any of this? Right. And
Right.
so then it's like, does it just become an enabling like situation where the therapist is like, yes, I'll happily take your $100 and send you on your merry way because you just want to have this, you know,
parenting session.
It can be, but then it also is up to that client to walk in the door and say, "Hey, I want to get to some of this deeper stuff."
Yeah.
Right. Because
Okay.
again, is
Okay.
not always the therapist.
Yeah.
I've had a lot of clients that say they want to make changes and we talk about it and I give them homework
Right.
and week after week, nothing changes.
Yeah.
Right.
It's like the clarinet lessons, you know. I did the clarinet.
Oh.
Guess what? If you don't practice,
Right.
you actually don't get better.
Yep.
And you
That's
know,
that's a
I
great
didn't want to
point.
do it. I didn't want to practice. And then you just go back in and you're
Yep.
cobbling together some
Right.
BS story to
Right.
make excuses
Right.
for why you
I
didn't.
had a
And it's like
headache.
they know you didn't practice. I mean, you sound
Sure.
like crap. Like you've
Sure.
zero improvement since last week, other than like whatever you got just by the
Right.
chronology of days
Right.
accumulating.
Right.
And you know how many weeks I went in and
Yep.
said I practiced.
I love
Right.
I knew I didn't practice.
Right.
to clarinet.
Right.
Oh,
Great
Bonnie.
Yeah. So you've got to be willing to do the work. You've got to be maybe willing to name like, "Hey, I realize I'm not doing the work."
Mm.
You know, I'm
So
not
here's the
ready.
question.
Mhm.
Let's say you're not willing to do the work. Is
Yep.
that you should not be doing therapy in that moment? Is that
I think it depends, right? There are some people that continue to come back because having that supportive person, having that voice helps them stay stable,
Hmm.
right? That maybe they're getting some nuggets out of those
Even
sessions.
just stability, like keeping them from
Yep.
slipping
Yeah.
farther. Or,
Yeah.
Right. And I've had some people that have said, "Yeah, I don't really want to make changes. I just want to come in and vent." Cool. That's awesome.
As long as we understand each other.
As long as we understand each other.
Yeah.
And as long as you're private paying. Insurance doesn't want to see that.
they want to see a diagnosis
Insurance
and
wants to
working
see,
toward
yep.
improvement. Sure.
And what are your goals and why are
Yeah.
you still, why
And
are
I
you
think,
still
if you are, I mean, you got to be ready. And there can be a lot of reasons you're not ready. It's just like with the food program itself, right? There's a
Absolutely.
lot
Yes.
of people that totally learn about BLE,
Right.
think to themselves, man, this is what I need to do. But maybe just
Can't do it.
with what's going on in life right now, they're
Right.
not ready.
Yep.
But, continuing to read, continue to think about it. Like,
Right.
anything like that. I think, go back and do some reading. If you're a BLE member, do the modules. You don't have to
Right.
engage with that. You can passively listen,
Yeah.
but it can kind of sink in and maybe in a few weeks or a few months,
Right.
and something else in your life that's very unstable stabilizes or whatever,
Right.
you'll be at a point where you're ready and then you can try
Right.
again. Right.
Right. Stages of change.
Yeah.
Some people are still in that pre-contemplative or contemplative. They're not ready to move into action. And that's a really interesting piece to kind of talk with your therapist about, where are you really on that continuum? What would you need to maybe be ready to move into action to make some changes on things?
Hmm.
Yeah.
And it's okay if you're not ready, but be honest about it. Like, don't be me and just like ghost your therapist or whatever, like be upfront. Like, I'm not ready to do this right now that we've talked.
Right.
I realize that I'm not ready, or,
Yep.
I need to do a little more work on my own before I'm ready
Yeah.
to engage with someone else.
Yeah,
That's okay too.
And I think that's a really important point, not to blame it on the therapist. Like,
Yeah.
"Oh, see, they didn't help me." Like, well, were you ready?
Right.
Were you
Right.
willing to dive in and do that hard work?
Yeah.
And I've had clients come in and kind of name that and say, "You know what? I realize I haven't been doing my stuff, and you know what? I want you to push me." Right? They have invited me
Yeah.
to push a little bit harder. And I'm like, got it,
Yeah.
you know?
That's great.
That's great.
Bottom line is therapy is really important. And,
Mhm.
It can be a really important tool.
Yeah.
100%.
yeah, if it's needed, it's really important. And if food was the way you cope with everything in life, which for a lot of us, it
Yeah.
was,
Mm-hmm.
I kind of think about it like food's like a pair of crutches,
Yep.
right? And therapy is a crutch that helps you move when you're in pain, right?
Yeah.
And if you take all the crutches away, you're going to go back to the food. You're just going to go back to it. You got to have
Yeah,
something to
something.
support yourself because
Yeah.
life is hard.
Yeah.
And so, if you're ready, to work on your stuff, like it's really important. It's
Mhm.
not, I know some people think therapy is a
Mhm.
weakness or, I don't know, it's just critical.
No.
It's an impartial person that doesn't just want to tell you everything's okay.
Right.
Well,
Or don't worry about
okay,
it.
let's say
Mm.
all therapists are not created equal also.
No, they're
right?
all
So
really different.
yes. Yeah. And that doesn't mean that everyone who has a therapy license is good at it.
Right.
How do I say that diplomatically? Did I do okay?
They may not all be your cup
Cup
of
of
tea.
tea. There you go.
Sure.
There you
And you got to find one that's
Yeah.
that good fit.
Yeah.
You got to date around.
go. With the dating analogy. I love it. Okay. Any other comments do we have about finding a therapist? Okay, so I think the bottom line is that obviously we do think therapy is
Mhm.
important. All of us have been in therapy. We think that if you need it, you should definitely get it. We think it should be more accessible,
Right.
obviously,
Yeah.
because of our bunny trail conversation we went down. I think that's really important as well. Obviously, I'm very passionate about
Mhm.
accessibility to people who need it because we do have a small provider crisis here in the
Yeah.
country that we live in. So for those that live outside of the United States, you might not feel that as severely as we do, but
Mhm.
it is hard to find good providers in all forms of healthcare here in the United
Yeah.
States right now. So I hope that this helped someone out there. If you know somebody who's looking for a therapist, maybe throw them this
Mhm.
podcast link and, say, hey, here's some good tips and tricks from tips from not tricks. Sorry. Some good tips from a therapist or something. No tricks. Sorry.
Just
Wow. Okay, we should end it here. Anyway, I hope you guys all have a beautiful day. And I forgot to say, if you have any show ideas, questions, or just want to say hi, please hit us up at our email at onthebrightlinepodcast@gmail.com or our socials. Okay, now have a beautiful day. Bye-bye.